All right.
Yeah.
Thank you. Thank you. All right. Everybody's. All right. Can you guys see the PowerPoint? Why can I not see you guys? What's going on? What do I have to do, Garrett?
We can't see the PowerPoint.
You can't?
No.
No.
Okay. I'm gonna take another deep breath.
Another day in paradise.
Yeah, it says share and it says screen.
So we're starting with 21.
That was my plan. I swear to God, I thought we did 20. I will go over 20. I promise you. I guess I'm going away for the weekend, but I will find time to do it somewhere.
So unit 4 ends at which chapter? I'm sorry.
Unit 4 should end at chapter 20, I thought.
Okay, so the new stuff we're doing today is for unit 5.
Yeah, so when I did the test today, I put in 21, 22, and 23.
Okay.
And 4 is just, it's 18, 19, and 20, right?
Yes, they should be chunks of 3, which is palatable. Now I see Dawn, but I don't see my PowerPoint.
You're so lucky because I look like
It's coming
crap
up
today.
now, yeah.
Yes, there it is.
Okay, so I see Caitlin, Dawn. I don't know why I can't see more than one.
Turn my screen off because I look.
Yeah, turn your screen off because I can see your kitchen or something. I don't know what's going on there. Please, I got my hair up and a man bun. It's horrible.
Yeah, I'm a mess.
All right, so it says it's recording.
Yes.
Yep.
Okay,
Yep.
cool. All right, guys. I want to just try to get through 21, and I said 23. I had to pick 2, so 22 just be now what happened?
Just wanted to give you a good update and the data.
What are you guys seeing right now?
Spirochetes.
But you're not seeing me?
No, I can see you.
Not that I'm. All right, we'll just go through. It's recording, all right?
Yeah.
Okay. I guess I'll bring it like this. All right, so spirochetes. These are the ones that are going to burrow into your skin. All right, and do you guys remember saying anything about anything that burrowed into your mucous membranes? How it was able to avoid your immune system? Nobody remembers. Okay. Mucous membranes, IgA. So a lot of these can get rid of IgA. And they can avoid your immune system. So Tryptomonia is the cause of the syphilis. Leptospidia is going to be caused from urine. And has anyone heard of Borrelia burgdorferi? No? You guys heard of Lyme disease? Okay, so it's a cause of Lyme disease. So Tryptomonia are going to be thin, regular coiled rods. All right, here's the deal. Most of you have it in your mouth. I know you don't want to think about that, but all right, it lives in the oral cavity, intestinal tract, and perigenital regions of human and animals, and that's how we spread it sexually. Right? Parasites are strict parasites with complex growth requirements. All right, so these can't live on their own. They have to go from host to host. All right, so they require live cells for cultivation. So this is one of those things you can't really tell me that you got it from toilet seat or maybe from a latex fomite, possibly, but maybe. All right, so Tryptomonia Politium causes syphilis. And if you guys notice in lab, I have a poster that says it sounds like something Harry Potter would say. It's kind of like a spell if you think that the sound of it. All right. Human is a natural host, extremely fastidious and sensitive, cannot live long outside the human host. And it's sexually transmitted and transplacental. What's the other word for transplacental? Vertical transmission. All right, so we're going to talk about syphilis, syphilis. So there are 3 stages of syphilis. All right, do you guys remember anyone? Did you learn anything in history of someone who had syphilis, who went kind of crazy?
Al Capone.
Al Capone, yes. And I think Napoleon, they say, kind of had it. All right, so in stage 3, it goes to the central nervous system. All right, stage 1, you're going to get kind of like a chancre. It's going to go away. And then you'll think, oh, that was nothing. And then a couple weeks later, you get a rash. That goes away. You think, oh, that was nothing. And then by the time it's tertiary, it's too late. It's gone to the brain. All right, and I can't think of, I had the name of there was a study the government did in the
Uh,
40s, the health,
the Tuskegee study.
yes, thank you. Who said that, Garrett?
Yeah.
Yeah, so apparently they found out about that, and these families were given millions of dollars. What they did was they knew these people had syphilis, and they studied it on these poor victims, right? So primary syphilis, there's a spirochete burrows in anywhere, and wherever you're having contact with it, it multiplies and forms. It's called a chancre. All right, so I think we talked about this before. We talked about Anopheles Mosquitoes, maybe talked about chancre. So fluid from a chancre is highly contagious. Right? So it's seeping out the spirochetes. The chancre spontaneously heals as the spirochete moves into the blood. Here's the problem. It's going into the mucous membrane, it's going into the skin here. It evades the immune system because it gets rid of IgA, causes a sore at the site. This heals. The person thinks, oh, maybe I nicked myself shaving or whatever's going on there. It goes away. They think nothing of it. And then a couple weeks or months later, you get a rash. It goes away, so they don't think anything about it, right? And I literally had someone at LA Fitness want to show me this chancre. I'm like, dude, out of my scope, not going to happen. But yeah, that's a true story. So a secondary syphilis, here's the rash. Spirochete is multiplying in the bloodstream. All right, what was the word we called these things before? Does anybody remember? Starts with a P. Petechia. So what's going on with petechia? Do you guys remember? Or it's very cutaneous. So what's being affected here? Nothing. Okay, so this is your capillary bed. Rash forms on the skin, palms, and soles with fever, headache, and sore throat. What does it sound like? Possibly the flu. The rash disappears spontaneously. All right, this goes away maybe a couple days, a week. Person thinks I'm completely healed, not a problem. They forget about the chancre they had. Now it becomes tertiary. Right? If untreated, tertiary syphilis forms damage to multiple tissues and organs. And these are things called gumas. Everyone see that where the arrow is here? All right. If you look at this person's pupil, it's called Argusan Robertson pupil. All right. And in grad school, we learned this because it's accommodative but not responsive. And our key for that was, I know you're recording this, but we used to call it like somebody who was drug-induced prostitute. They were accommodative but non-responsive. That's how we remembered that word. All right. And that right there, if you guys can see that, that's something called Hutchinson's teeth. I'm not sure this is in your book, but it can pass through the placenta to the fetus, vertical transmission. This goes to the fetus. And what does this look like here? Is anybody can anybody see that? What part of the body is that? You guys can hear me, right? No?
Is that the sublingual?
No, sublingual will be lower. Sublingual will be under the tongue. This is the palate. Person almost has a cleft palate if you look. Symptoms include nasal discharge, skin eruptions, bone deformation, and nervous system abnormalities. So the mother had this. She transmitted to her child during pregnancy. So there's vertical transmission of this. Your book calls it an STD. We really can only call it STI now. Sexually transmitted infection. We really can't call it disease. It's not politically correct. Right, so stages of syphilis can mimic other diseases. So a lot of people with the chancre, they think that it's just a sore irritation. It goes away. They get secondary syphilis with the rash and the petechia. They think it's allergic reaction or the flu. They forget about it. Goes away. And then the problem is if they don't get it treated with penicillin G or something, it becomes tertiary and it enters the brain and nervous system and people go absolutely bonkers. So a lot of times, Any of you that work in nursing homes, you may have patients who have dementia, all right? It's possible that some of them have tertiary syphilis. Now, these are other types of syphilis from Tryptomonia, but these are all cutaneous. What does that mean? It's superficial, all right? So it's really not systemic in the bloodstream, all right? So I know there's 2 questions on this. You're probably not going to get it, but these are just other names for these non-syphilitic Tryptomonium diseases. These are all superficial. So Benjay, Jaws, or Pinta are very similar. They're not really going to be in this part of the country, but if you see that, and I have seen it on board exams, so I just kind of mentioned it here, and I did put it on one of your exams. All right, Leptospidia. All right, this is from urine. So when you see this question, they're going to ask you, transmitted by, you could say water, urine, usually it's like coyote or rabbit or something is peeing near a stream, it gets in the stream and you consume it. These are tight, regular individual coils with bent or hooked at one or both ends. It's listed here, it's still gram-negative, but it's spiral. So it actually goes in and it burrows like a corkscrew, right? Right, so Leptospidia biflex is harmless, free-living saprobe. What does that mean? Something saprophobic or saprophobe. These don't need a human host. They decompose things. They're bioremediators. All right. Leptospidia and Tarragons. All right. This got its name because it literally looks like an upside down question mark. Interrogating. That's a question. That's how it got its name. Causes leptospirosis. It's zoonotic. And so it's carried by animals. It just happens to be able to cross into us because we're mammals. Bacteria shed in urine. Infection occurs by contact with contaminated urine, targets kidney, liver, brains, and eyes. And the question that they'll probably give you at some point is going to be a person was camping near a stream and there's going to be something about coyotes or rabbits or something. They'll give you some kind of clue as to this and they'll tell you it's some kind of a spiral shaped bacteria. It's a clear case study. It should be super easy, right? The issue is sudden high fever, chills, headache, muscle aches, conjunctivitis, and vomiting. Sounds like the flu. People don't realize they have it. Long term, if it's not treated, affects the kidneys and liver. 50 to 60 cases in the U.S. Yearly. And this is really going to be in rural areas where somebody's hunting or fishing or hiking. Right? You're not going to get it probably in Amherst, unless you go to the park or whatever, but you're probably not going to get this in normal civilized areas. Borrelia, all right, and I said Borrelia burgdorferi. I know there's going to be a question in your near future on my exam, and I guarantee you on other exams, they're going to have this on here, all right? So what's the key symptom for Lyme disease? 50 to 60% of the cases have what? I have all night, guys. Bullseye rash. You guys have never heard this? Okay. All right. It's possible. All right. Borreliosis are transmitted by arthropod vector. Does anybody know what an arthropod is?
Tick.
Tick. All right. Possibly flea, but yes. Hermensi is relapsing fever, and I always memorize it because Hermensi has double I at the end, so it's a relapsing fever. All right. So if I gave you guys a really horrible, like, case study or whatever, relapsing fever, how would I trick you guys, or what would be a thing I would tell you? Somebody has a relapsing fever. Now I know this will be literally the 4th thing we've gone over that has relapsing fever. And what was the cause of that? All right, this is another one that can change the antibodies. It changes the antigen markers on itself. So every time your immune system makes antibodies to it, it literally switches. So you get the cyclic relapsing fever. So whenever you have that, you know that this organism changes its antigens on the outside to evade your immune system. That's how it can persist, right? Lyme disease carried by,
Texan fleas.
Jackson, please, thank you, it sounds like Ian. All right, so wild mammalian reservoirs, squirrels, chipmunks transmitted by ticks is hermensi, which has a relapsing fever. This is not Lyme disease, but similar to it. All right. So after 2 to 15 days of incubation, patients have high fever, shaking, chills, headache, and fatigue, but it ramps up and down. All right. So as the parasite changes, the immune system responds, resulting in recurrent relapses. That's how it does it. It changes the antigens. You see, this is the spiking pattern, up and down. So remember, if you get like confused or nervous, this is going to have 2 eyes at the end, so you know it's relapsing. Right? That's how I remembered it in grad school. All right. Borrelia burgdorferi, the cause of Lyme disease. This has a complex life cycle involving mice, deer, and transmission of ticks. Now, please realize, no matter what they've told you before, this has to go through a complete life cycle, so it takes more than a year. The tick, and we are an incidental host. What does that mean?
Doesn't need us for its life.
So it just bites us, but it really wants a deer or a mouse, but we just happen to be walking to the woods and we don't have shorts on or whatever. It just happens to bite us, right? I can't hear you. What? All right. So the mouse is infected with the Borrelia burgdorferi. All right. It has a larval tick. All right. Then it goes into the nymph. The nymph usually affects the deer. The adult tick carries on the whole cycle. But we just happen to be an incidental host with this. All right. And you guys know the story behind this in Lyme, Connecticut? How the people were having all these problems and they couldn't figure out what it was. It was a bunch of females who figured it all out. They traced it back to the tick. Huh?
I thought it was supposed to have been caused by some chemical. Someone was messing with some chemicals they shouldn't have been, or dumped them, or something like that.
I didn't heard that, Garrett. I could research it though.
Yeah, I don't know. Maybe.
I don't know. Anything's possible, nowadays. I believe anything. We won't get into the details, but okay. All right. So it's acquired by tick bites, non-fatal, slow-progressing syndrome that mimics. So here's the problem. These people had fever, chills. They had all these muscle aches. And if they were female, they just said, well, you have rheumatoid arthritis. And they realized it was really, really prevalent in this one area. I think it's Lyme, Connecticut. That's how it got its name. So these women literally went in and they investigated and they found out what it was carried by the this tick. All right, and here's the bullseye rash. All right, so 50 to 70% of the population actually gets this. All right, so literally we're going to talk about a few of these, but if you're going out hiking, I know you guys think I'm a crazy hippie, but have somebody check your legs and your back areas you can't see, because if you have these things, you're not going to know they're there. And these carry rickettsia, they can carry all kinds of things with them. So fever, headache, stiff neck, and dizziness. This could mimic fever, could mimic a cold. Hopefully it's not going to mimic meningitis, because we talked about that before. That's life-threatening. You want that checked immediately. If untreated, can progress to cardiac and neurological symptoms, polyarthritis. So literally more than one joint is affected, right? So if you have one joint that's affected, it's usually not something systemic. It's usually something having to do with your kinetic chain, all right? But if it's many, many joints, it's usually systemic. So we have to rule out rheumatoid arthritis or some kind of self-immune disease. Generally, it's something systemic. We'll talk a little bit about cruciform bacteria. So these are going to be comma-shaped or gall-shaped. These cause enteric diseases. So whenever you guys see enteric, what should you be thinking immediately? Intestines, all right? Anything enteric is always going to relate to the intestine. So it's going to be duodenal, jejunum, possibly large intestine, but generally it is small intestine, duodenum. Vibrio, all right, comma-shaped rods, a single polar flagellum, all right. And you guys have heard of Vibrio cholera? Anyone heard of cholera? posted some videos on that. All right. So cholera is generally self-limiting. If you want to flush it out, the problem with cholera is usually it's from feces contaminated water. So usually it's either from you have no sanitation, no outhouses, or there's horrific hurricane or tsunami or something like in Haiti where it disrupts your septic tank or your whatever, and that gets mixed with your drinking water. These people get it. The problem with other countries where this is common is they're rehydrating with the same water they got the cholera from. So Campylobacter are short spirals or curved rods, one flagellum. So this can cause severe enteric problems. And Heliobacter, spirochete with tight spirals and several polar flagella. And you guys heard of H. pylori? Hopefully. Heliobacter pylori causes ulcers and leads to major stomach cancer, and it can cause a lot of pancreatic illnesses. So Vibrio cholera is common shaped bacteria is ingested in food and water that's usually infected with sewage, because this is something that someone's going to secrete, all right? And usually they secrete it every time they go to the bathroom. There's other diseases here that are very intermittent, right? Infects mucous barrier of small intestines. It's non-invasive. So when I say it's non-invasive, it does not invade the intestinal system, all right? So generally there's no blood. We're talking about some of these other ones that are invasive. They invade usually the end of the small intestine. They're much more invasive, so you're gonna get some diarrhea, and you're gonna get a little bit of blood because it's actually invading the tissue, right? This releases the cholera toxin, causes electrolyte and water loss through secretory diarrhea. So it literally releases, it docks up next to it, releases the toxin, causes the cell to release a lot of its intracellular ions. All right, water follows. Right, so this person has a lot of very secretory diarrhea. And if you see something called rice water stools, it's diagnostic for cholera. All right, literally, it's part of the cell wall. These don't invade, but it actually takes part of the cell wall with it. It literally looks like pieces of rice. All right, so these people get very, very dehydrated because all the fluid leaves these cells in the intestinal tract. All right, so how do these cells replenish their water, or how do they replenish the fluid in their cells? Nothing. You guys are killing me. All right, so it actually pulls the fluid, all right, from the capillary bed. Capillary bed's going to push fluid out. These cells are going to absorb it. So this person, unless they rehydrate, become very, very hydrated, they start losing a lot of their blood volume because they're replenishing these cells. Without the fluid, these cells won't operate. Rehydration with tetracycline for this. Usually it's self-limiting, like I said. A lot of times this is self-inoculating, or someone's drinking from the well, or someone's not washing their hands really well when they're cooking, or whatever, however you're getting this into the food supply. So this chart just kind of tells you how Vibrio cholera it docks up next to the cell, releases the toxin. You guys know it's cyclic AMP pumps and AMP and sodium potassium pumps. It kind of shuts them off. So a lot of fluid leaves. It doesn't repump it back into the cell. This person has secretory diarrhea. These are other Vibrio pathogens. Now, if you look at these say salt-tolerant inhabitants of coastal waters associated with marine invertebrates. So these will not be in fresh water. All of these, Vibrio homunculus is gastrointestinal from raw seafood, similar to cholera, but you have to get from seafood because this Vibrio is salt-tolerant, all right? It doesn't like to live in fresh water, like seawater. Campylobacter, right? These are S-shaped or gall-shaped. If you look, they kind of look like gall wings, right? And these have polar flagella. So they have flagella on each end. Right? So they're very motile. And common residence in intestinal tract cavity of birds, all right, and mammals. All right, so you get this usually from, you have to get it from some kind of animal, or bird feces, it's got to be mixed in with the water. You have to consume it. All right. Campylobacter jejunum, what do you think that affects? The jejunum, very good. Campylobacter fetalis or fetus affects mom, but she vertical transmission, transplacental gives it to her kid. It can become very fatal for the fetus, obviously. Okay. It's transmitted by beverages and food, reaches the mucosa of the last segment through the intestine near the colon. So these, Campylobacter jejunum and cholera, you can differentiate this basically because one of them is going to affect the intestines at the very end of the small intestine and the large intestine. All right. The other one doesn't. All right. I know we're not in pathophysiology, but what would be the difference if somebody was bleeding gastrically or somebody was bleeding at the end of the intestine? So you had a stool sample. How would you differentiate whether this bleeding was distal or proximal from the stomach? Anyone want to guess?
Would the color be different?
Katarina, what are you saying?
Would the color be different?
Yeah, so if it's an upper GI bleed, like stomach, H. pylori, duodenal, by the time that blood reached the large intestine, become feces, it's going to be black or tarry, like tar. So if it is a frank blood, if it's red or it's not black, we know it's more distal. It's closer to the large intestine. It didn't have time to go through the digestive tract and get digested. So it's really a lot more red or pink. So we call that fresh. If it's darker, we call it cult or dark. All right, so frank means bloody or more proximal to the large intestine. If it's tarry or black, we know it's more distal. It's closer to the stomach or duodenum, and it went through the digestive tract and it was partially digested, turns it black. Right? So this has an enterotoxin. Entero always means digestive. All right, simulates secretory diarrhea like that of cholera. Symptoms: headache, fever, abdominal pain, bloody or water diarrhea. All right, so this could be, you can think it's an amoeba, Amoebic Dysentery, or you might think it's Campylobacter. Right. Campylobacter fetalis or fetus is opportunistic pathogen that affects debilitated persons or women late in pregnancy. So for this, you have to have a diminished immune system or you're late in pregnancy and you transmit it to your fetus. H. pylori, I'm sure everyone's heard of stomach ulcers. But they used to think it was in people like me that were, alcoholics, older age, type A personality. But they found out most people that have stomach ulcers have H. pylori. This actually burrows into the gastric lining. That's your problem. So it's a gastric pathogen. Curved cells are discovered in 1979 in stomach biopsied specimens. Causes 90% of stomach and duodenal ulcers. Right. It's also apparent cofactor in stomach cancer because this is constantly breaking down the stomach, and as it keeps healing, you're increasing the mitotic rate. You're increasing the possibility of having cancerous cells. You're saying that increases the factor. All right. People with type O blood have a 1.5 to 2 times higher rate of ulcers. Right. And they're also finding out that people with type O blood have a higher incidence of malaria and a lot of these other vector-borne diseases. We don't know why exactly, bee stings, because they're saying there's something, either sounds weird, but either in the CO2 they're expelling or the antigens on the blood. The type O people have more propensity for some of these diseases. I know it sounds crazy, but they're finding out statistically that's true. All right, the other thing is this produces urease, which converts urea into ammonium bicarbonate. So does anyone know what the normal stomach pH should be? they could teach you, it's 2 or 3, it's really low, so it's very acidic. All right, but this Helicobacter pylori produces urease, converts urea into ammonia and bicarbonate. Why would that be significant? What does bicarbonate do?
It evens out. It's more basic, so it evens out the acid.
Thank you, Katerina. Yes, it is very alkaline, so it actually increases the pH. Same thing that happens in your duodenum when after your stomach releases the chyme into the duodenum, it's very, very acidic. All right, so when your duodenum is full, your pancreas says, oh, we got a meal in there. It's going to secrete some bicarbonate. It wants to raise that pH. So when that chyme goes through your intestinal tract, the pH is high enough so the enzymes in the duodenum, from the ampullator or the gallbladder, any of those chemicals or bile that comes down can activate it. If we didn't have that, it would be way too acidic. None of these enzymes would actually work. Thank you, Katerina. All right. So let's talk a little bit about medically important bacteria of unique morphology and biology. So in other words, we don't really have a place to categorize this, so we're going to throw it at the end. All right, these are unrelated to each other, but similar in morphology, pathogenicity. They all are atypical. So they don't actually have, like, they're not curviform or spirochetes. So we put them all in this class. All right. But atypical bacteria pathogens, Rickettsia include pathogens that rely on arthropod vectors. There's going to be ticks, possibly fleas. All right, and we've all probably heard of chlamydia, Chlamydiaceae, cellular pathogens that alternate between element and reticular body. So these have actually 2 different forms. And chlamydia has to have a human host. All right, it can't produce its own energy or ATP. So it goes back and forth. And the chlamydia, you probably have all heard, causes STIs, right? It also causes a major eye damage in newborns, right? Different form of it. And mycoplasms lack a cell wall and are highly pleomorphic. Not going to spend any time on that at all, really. So Rickettsia genius, small obligate intracellular parasites. So these literally, once again, if they're obligate intracellular parasites, they have to go from cell to cell. They can't really live on their own. All right. These are non-motile, pleomorphic rods or coccobacilli. So they're not, if you look, they're not all exactly the same. And they look really large to me compared to regular bacteria. So ticks, fleas, and lice are involved in their life cycle. Bacteria enter endothelial cells and cause necrosis of the vascular lining, right? Vasculitis, vascular leakage, and thrombosis. Right, so Rickettsia, these enter the endothelial cells, right, cause necrosis of the vascular lining. So what would we expect to see with this? Hello, you guys know what your endothelium is?
Skin.
You're lucky I can't see you guys. All right, these are the vascular lining. All right, so if this were to destroy your capillary beds or your arterioles, what would you expect to see superficially on the patient?
Bruising.
Bruising, your petechia. All right, very good, thank you. All right, so one of these is going to be Rickettsia causes Rocky Mountain spotted fever. People they're infected with this. They literally have this rash that looks very similar to secondary syphilis because it's going in and it's destroying the capillary beds. So endemic typhus, right, carried by lice, it starts with a high fever, chills, headache, rash, right, recurrent form. So if they ask you on a test, or I know Dr. Rowe used to love this. She asked us, endemic typhus was carried by lice, but then endemic typhus was carried by fleas. So that's the difference. Tokugawa is carried by lice. Typhi is carried by fleas, or by mice or rats. So, if you were living in you wouldn't get this somewhere where you wouldn't get it from a cat or a dog. You have to get an area that had mice or rats or You have to be in poverty-stricken area, homeless. They have to give you something like that. Rocky Mountain spotted fever, Rickettsia rickettsii, is zoonosis carried by dog or wood ticks. Seen this question all over the place. They love to ask it. Most cases are in southeast and on the eastern seaboard. Distinct spotted rash may damage heart and central nervous system. Because remember, this is going to enter the endothelial system and start damaging it. So you're going to definitely see a rash. So there's just some listing from your book just showing you the difference. And there's Rickettsia rickettsii, and you have to have some dog for mice, flea. It's carried sometimes by ticks, usually they're dog ticks, right? But it affects usually blood vessels, central nervous system, and it can affect the heart. But it's endemic to North America, right? So if they're going to give you this question, they'd have to tell you you're North America. You wouldn't get it in South America or somewhere where it was too hot, right? It's got to be in the temperate zone for this. Right, here's Rocky Mountain spotted fever. You can definitely see that. Q fever, usually it's carried by milk, I think. Yeah, they're gonna, yeah. Causes Q fever. If you ever see this, I'm never going to ask you this, but if you do see it, they ask you milk for some strange reason. I don't know why. I've always seen that. Right. I'm not going to ask you that, but you've seen it. All right. Chlamydiaceae family. Small gram-negative obligate intracellular parasites. Now here's the deal. With chlamydia, it has 2 stages, right? We have and this is obligate intracellular. It can't live. It's got to be passed from person to person. Small metabolically inactive extracellular infectious form released by the infected host. So if someone is releasing chlamydia, right, somehow sexually transmitted or however, right, they're releasing elementary bodies, right? The reticulated bodies are not infected because they're inside of this cell, all right? Anyone want to guess what kind of cell that is? Right. It's white blood cell. It's a phagosome, all right? But once again, once it infects one of these white blood cells, it has a free ride anywhere it wants. Phagosomes don't kill it. And here is chlamydia trachomonas, right? And it causes major cases of conjunctivitis. Conjunctivitis. All right. I've only seen 2 cases of this, and I couldn't put enough gloves on in my life. It was gross. And this person kept screaming at me because they couldn't wear their contacts. Can you imagine what that would feel like? It's very, very grainy. All right. So trachoma attacks the mucous membrane of the eyes, downstream tract and lungs. Ocular trachoma is severe infection, deforms eyelid, cornea, and may cause blindness. These are not really good contact lens wearers. Right? And then the STI, or sexually transmitted disease, is secondary, most prevalent STD. All right, causes inflammation of the ureter, cervix, Salpinges, causes pulmonary inflammatory disease, infertility, and scarring. So this actually gets into the fallopian tubes, causes major scarring. These people have they have difficulty conceiving. Right, but inclusive conjunctivitis occurs as the baby passes through the birth canal, prevented by prophylactics. And I'm pretty sure I'm probably wrong, but I still think they use silver nitrate, as far as I know. All right. Here's chlamydia, human reservoir, and 2 strains can affect humans. So we really are the reservoir for this. So we just pass it back and forth. All right, so trachoma, once again, is the ocular form, attacks the mucous membranes, right? It can affect the genitourinary tract and the lungs because they're all covered with mucus, right? And here's the lymphogranuloma venereum. So this is a venereal disease. It attacks the lymph nodes right here. Disfiguring disease of external genitalia and pelvic lymphatics, right? And remember, guys, I don't have you in class, but if you're going to play doctor, please, like I said before in class, turn all the lights on, put your glasses on, check everything all out, proceed. So check it all out. Chlamydia, philia, pneumonia causes atypical pneumonia in a person in asthmatic patients. So this is, like I said, this is in the lungs. It can be in the mucous membrane. It can cause some pneumonia. Right? Has anyone seen this word before? Chlamydia, right? Whenever you see this word, it's always caused by birds. Orthanosis is birds, right? So chlamydia, petechia, or spitechia is an orthanosis is caused by birds. If you see that in a case study question, they'll have to somehow relate this to somebody being around birds for some strange reason. All right, and that'll be one of the answers there. And then we'll talk a little bit about dental disease, and we talked before about biofilms. And I told you guys before, your book says 400 species of bacteria in your mouth, but I've heard over 500. Right, and that's how dental disease progresses. Is anyone here going into dental hygiene? No, thanks. All right, so you guys remember how it starts? Anybody want to jump in here? What's the first layer of the biofilm doing? Now, I know I've gone over this at least twice before. Nothing?
I feel like it becomes more pathogenic the more layers there are.
Right. Well, it becomes more pathogenic and it tends to evade your immune system. But what's the first layer doing, Katerina?
Is it like setting up like a ground layer? Like,
Yeah. So how's it doing that? What's it feeding on?
does it feed on organic matter? Like whatever it's on, like what's directly below it?
Yeah, it's feeding on organic matter. It's feeding on all the sugars. All right. So we didn't get to do the Enterobacteriaceae lab, but if it was fermenting sugars, it's going to change, produce an acid, it's going to change the pH. All right. So any of these organisms are they're going to lay down in your teeth. They're going to they're going to produce a pellicle, which is that slimy layer. So I'm assuming you guys have all brushed your teeth at some point today or yesterday. All right. So your teeth felt pretty clean. And then after a while, they got kind of slimy. That's a pellicle. All right. After that, they get that harder, rough feeling. All right. That's plaque. All right. If you don't get rid of the plaque, it turns into calculus and not the math kind. All right. This is very concrete calculus, tartar formation that you really have to scrape off. All right. Now, that being said, after you have this biofilm going on, what do you think the oxygen concentration is at the base layer of this biofilm? So let's say the first one lays down the biofilm, changes the pH, starts eating through the enamel with the acid. What do you think the oxygen concentration starts to become? Higher or lower? It's lower. So a lot of these things that are causing disease and periodontal disease, they are anaerobic. As these biofilms get laid down, a lot of the ones that cause gingivitis and start messing with the gomphosis, they are anaerobic. All right. So they don't like oxygen. And as these biofilms develop, they're consuming the food, changing the pH, changing the oxygen concentration. So now we have a niche market for something else. So as each one lays down, it changes the environment. Another bacteria comes along that finds that very favorable. Other ones can't live in that. So it develops this great big layer upon layer upon layer of niche bacteria. And just here's the whole list of formation of dental carriers. All right, so we have the colonization of Streptococcus, usually Streptococcus viridans or mutans. All right, it forms that layer of plaque. All right, produce acid, dissolves the enamel. The plaque's allowed to stay. These secondary invaders form, and there's our friend, Mr. Syphilis, right there. Acid dissolves tooth enamel, leading to caries and tooth damage. It's just showing you. You guys can read through this, because I know you all read the chapter before you got here, but you thought we were going over 20, so I'm going to give you a break. All right. So as there's a tooth enamel, as these all change, each one of these layers is setting up, changing the atmosphere, and all these other Synomyces, all these great big ones. There's Tryptomonias right there, the little syphilis there. We're not going to we're gonna wonder how they got that. Anyway, they're all laying down all these layers, changing this. If this doesn't get cleaned away or scraped away, it starts forming biofilms, very, very hard tartar, needs to get scraped away. And then here's where we have the problem. In here, changes the environment. Now we're getting into the gum and the gomphosis. This is anaerobic. So these start invading, causing gum disease and dental caries and pyorrhea and all kinds of problems with the teeth. Right. Give me a minute. We'll switch the PowerPoint here. Hey Siri, what time is it?
1 moment. It's 5:54 p.m.
She's useless. End of show. Oh my God.
What's the Jeopardy theme song?
I'm listening to anything you have to say. What, Garrett?
What's the Jeopardy theme song?
Yeah, exactly. I don't understand. This is like not my first, I think. End show. Let me try that. I'll try anything at this point. Oh yeah, here we go. Let's talk about parasite. Ooh, anyone know what that is?
Elephant.
It is. How's that caused?
Hmm.
It's caused by the Filarial worm. I went to school with a girl who had that. One of her legs looked like that. 1984. She had a man crush on me, but it didn't work. Didn't work out. Play.
How painful is that?
After a while, it's very painful because what happens is these Filarial worms, they get into the lymphatic system and they jam it up. So no fluid can go into the afferent or the efferent. So the fluid just backs up from the hydrostatic pressure, from oncotic pressure, and the skin just stretches and stretches. And you can't even go in and remove the lymph nodes and replumb it. So it's pretty painful. But after you've been bit by this, insect and you start having some problems, I would think you'd go to the doctor, but that's just me. All right. So I think this is going to work. All right. So clearly my favorite chapter, parasitology. So we'll talk about some parasites. So we'll talk about, so these are going to be relatively large. And before I get started, a lot of these parasites are eukaryotic. So what blood cell would be elevated, Brianna? Let's put it on the spot. Starts with an E. I'm calling Dr. Hoffman as soon as I'm off the phone here.
Eosinophils.
Thank you. Yes, eosinophils. Yes. All right. So the study of eukaryotic parasites, protozoan, all right, and helminth. All right. You know what helminthes are? These are worms. All right. So it's going to be large. The smallest ones we're going to see today are pinworms. All right. And I don't know if you've seen these or you've heard about these, but these are relatively common. And the female leaves the digestive tract, and she lays eggs at the end of the rectum, causing itching. The kid itches, wherever. It's under his fingernail. So he's going to put his fingers in his mouth and self-inoculate, or he puts his fingers in his sister's mouth, or he plays with toys, or, on Saturday morning, he goes downstairs and starts digging in the cereal box to get the prize and infects the whole family. Causes 20% of all infectious diseases. So that's actually huge, all right? The other thing I want to point out is, I don't know if you guys have been to a third world country. And I'm not talking about Cancun or, these, huh?
Los Angeles.
That's third world, yeah. I'm talking more like Peru or India, all right? So at least 15% of that population has some kind of parasite, normal for them. Right. As I said before, when we're talking about the autoimmune diseases, literally back in the day, everybody had something. So your eosinophils and your immune system was always attacking something. It's, us that live in Orchard Park or wherever, and we live in our sterile vanilla boxes with air conditioning and sealed windows. We don't really come across this. And, they're saying this is why a lot of us are having a lot of these autoimmune diseases along with genetically modified foods, causing a lot of these antigens, or the immune system is getting bored, it's trying to attack itself. All right, less prevalent in industrialized countries, increasingly common in AIDS patients. Why would that be a fact? Because these people are already immune compromised. So that their immune system, they don't have any or they don't have any CD4 cells, all right? So they have nothing triaging their B cells for antibodies, nothing directing their T cells. And if their eosinophils and macrophages can't wipe this out, they are going to be infested with this. So a lot of us, if we come across something, our eosinophils can, probably get rid of most of these as long as the infective dose isn't super large. Today, we're going to talk about Trigomonas, some tapeworms, some fun stuff. Right. So parasitology, protozoan, these are going to be large one-celled organisms, and helminthes parasites exist worldwide. Right. Occur among people in rural, underdeveloped, or overcrowded places. So you have more contact with it. They're rural, all right? I'm not saying they're savages, all right, but they're probably walking around bare feet or whatever. A lot of times they can be infected, or they can get bit by some of these arthropods, hemophilites, and get infected with this stuff. All right, emerging as serious threats in developed nations. Right? Parasitic infections often involve several hosts. All right, so I know there's a question on your next exam, the difference between a definitive host and an intermediate host. Anybody want to guess?
Intermediate is just like a hopping zone for it, where definitive's actually where it's like taken root and been multiplying.
Yeah, perfect. So intermediate host, a lot of times it's just by the vectors just carrying it. And you guys have to remember, like with malaria and some of these other diseases, they're not affected by this at all. They're just literally UPSing or Amazon priming the thing to you. You are the definitive host. And most of these organisms, they're going to multiply in you, all right? And their hope is that you will shed the cysts, or you will excrete the worms, or if they leave your digestive tract, they're going to go to your lungs, you're going to cough them up, you're going to re-swallow them, all right? So then your stomach acid is going to break down the cysts of the eggs, the calcified cyst or the eggs, and you're going to redevelop them into your duodenum and your small intestine again. That's what they're hoping for. Right, parasites can infect humans in one of three ways. You can ingest them by eating them, vector-borne transmission. We're going to talk about the red bug, tsetse fly, so African sleeping sickness, Chagas disease, or direct contact back and forth. All right. And remember, in the beginning of class, I said there's a bug that goes out there, and it while you're sleeping, it bites you on the eyelid of the lip. Right? And it takes a dump, and then you scratch where it bites you, and then you infect yourself. Right? Chagas disease with the red bug. We'll see that coming up. Right? So today we'll talk a little bit about Anketh Amoeba. All right, so this is an organism that lives in water. All right, if you damage your eye or part of your nose, this can get in. And what's above your nose or your eye right here? In case you don't know, this is your brain, central nervous system. So these are amoebas, right? They get into your brain, they start consuming or eating your brain. It causes a lot of neurological problems. Regular Filari is another one. It lives in water. It can start affecting your brain. And we'll talk about the Trypansomia, the kissing bug, Revlet bug, right? Plasmodium, what does that cause? Malaria. Wucheria filaria causes elephantitis. Sandfly leishmania causes Baghdad boils. It's cutaneous, it bites your skin. All right, tsetse fly causes African sleeping sickness. Right. Talk about Nectar americanus. This is a hookworm, digs into your GI tract. These can literally drink like a half a pint of blood a day. Gross. Right. Anketh Amoeba, we'll talk about Giardia, right? And Trigomonas causes a nasty venereal disease. Right, so typical protozoan pathogens, these are single-celled animal-like microbes. Most have some form of motility. So usually if there's amoeba, it has pseudopods. If it's some of these hemoflagellates, it can move around, kind of like an eel. All right, some of them have flagella. Some of the ciliates, Betulinium is a ciliate. It's the only one that we'll talk about. That's usually pigs, very rare. Horses, possibly. Right. So these life cycles propagate by simple asexual cell division, right, of the actin feeding stage. So whenever we see trophozoa, right, that's an active feeding stage. So that's going to come up with malaria and a couple of these other ones. All right, may undergo formation of a cyst. So if something can cyst itself, what might be the advantage of that? I didn't hear you, Katerina. Oh, I thought you said something. All right, so these undergo cysts. All right, so these are not like endospores, but they're encysting. So as they go through your digestive tract, we're assuming they're going to be excreted, and that if it's encysted, we're hoping that another host will come pick it up, whether it's a mammal or a human. We're going to swallow that, all right? Because it's outside, it's relatively protected by this calcified cyst. We swallow it, it gets into our stomach. The pH is low, it's very acidic, it breaks it down. Then we send that cyst to the duodenum, it unencysts itself, and it can start reproducing in your digestive tract. And we're hoping that it lives long enough to make more cysts and you excrete it so someone else can pick it up. So a lot of these pathogens, their whole job is to infect you and hope that you infect somebody else, propagation of the species for them. Right. Some of these are going to have a little bit more complex. It includes asexual or sexual phases, and we'll talk a little bit about that with malaria. And I wrote a couple of these things. I color-coded them for you. All right, protozoa are unicellular eukaryotes, so these are relatively large. All right, and I know we went over antibiotics. What's the problem with trying to get rid of eukaryotes in the human body?
They're too close to your own cells, so it's hard to like target parts of the cell to actually kill without damaging your own.
Right. So if we were talking about, we'll see how you guys are paying attention here. All right. So if you were talking about eukaryotes, what would be one of the antibiotics that we could, what type of antibiotic could we use to kill this?
NyQuil.
Right? Did you say NyQuil? What? Remember, anything that has RNA, like the tetracycline, those RNA inhibitors, they usually can do it. All right, but the problem is, we start messing with our own RNA. But we'll talk a little about that. And I said with you guys before, I'm not going to expect you to memorize all the antibiotics. That's really not our job here. Some professors want you to memorize that. I don't think it's that important. But a trophocyte, I said before, is a feeding and reproducing stage that lives within the host. So trophocyte always means feeding. They're always living within the host. Right? If you see cyst, it's an infective form that survives in the environment. Right? And I said it undergoes encystment when ingested in the stomach, develops into these feeding forms. Right? Trophocytes undergo encystment before leaving the host in feces. So these protozoa, they make these hardened cyst-like eggs. They hope that you consume them or another mammal consumes them. Stomach acid breaks them down, and then you consume them and you produce more trophocytes, and they can perpetuate this whole cycle. Trophocytes classified group by their mode of locomotion, right? And we'll talk a little bit about these ciliates. Phenylendium is the only one that we're going to talk about. Amoebas, they have those pseudopods, and the flagellates have flagella. Hemophiliates, like with malaria and other things like that, they're going to be big, right? They have like eel-like motion.
There's stuff in here.
Right. And there's just the different stages, all right? So these are the stages as if you see a mastigote or promastigote, epi means on, or tropomastigote. What does mastication mean?
Eat.
Yeah, eat, all right? So they're just saying, I don't know why they call them this, but amastigote means there's no flagella. It's starting to produce one. This is on, and then tropomastigote. These are hemophiliates. These actually can move around in the blood like an eel.
You can get it. You can take it.
All right, so we'll talk a little bit about Entamoeba Histolytica. All right, so alternates between trophocyte, which is a feeding stage in the body, motile by means of pseudopods and a smaller non-mobile cyst. So these are basically great big things. They move by pseudopods. They're going to secrete cysts in hopes that someone consumes them and perpetuates the species here. Entamoeba are enter always means digestive tract. Histolytica carries asymptomatic in the digestive tract of humans. No animal reservoirs exist. So we literally pass this back and forth to us, most commonly in drinking water, contaminated water. You can get this in, it used to be very, very common in Mexico, even with ice cubes. It didn't kill them, supposedly they said. Encystment occurs in the small intestine after our stomach acids breaks it down. Trophocytes migrate to the large intestine. They're going to make cysts and get excrete out, hoping that someone else consumes the cyst and propagates the species. All right, but have you guys heard of amoebic dysentery ever? Okay. So there's 3 types that result in infection. Luminal amoebiosis, so it stays in the lumen. All right, not a problem. You're going to just, hopefully you're going to flush it out. Luminal is great, not great, but if you had to pick one. Asymptomatic, all right. Invasive amoebic dysentery. So invasive means what, do you think?
Blood in the feces.
How is it going to get blood in there, Katerina?
Really, is it burrowing into the walls and actually like your cells?
It's invasive, so it's severe diarrhea, colitis, inflammation of the colon, appendicitis, right? Because it can, it'll start going to the appendix at the end of the small intestines. And then ulceration intestinal mucosa, this the bloody stuff. All right. The worst is invasive extraintestinal amoebiosis. So the invasive goes all the way through, crosses the cell, gets into the basement membrane, gets into the blood supply. All right, now it can go anywhere it wants. All right, amoebic dysentery and invasive extraintestinal amoebiosis can be fatal. All right, and there's cases where it goes to your lungs. All right, and luckily this amoeba can't go to your brain like a Filaria or Anketh Amoeba. So humans are the primary host. Cysts are swallowed and arrive at the small intestine. Alkaline pH and digestive juices stimulates the cyst to release 4 trophocytes. You swallow 1 cyst, your stomach acid breaks it down, gets your duodenum, your intestines. The trophocytes, 4 trophocytes go to your large intestine. They make 4 cysts. You excrete them, and you're hoping that someone else picks them up. And here is, you know, 90% of people are asymptomatic because it's luminal, all right, or it's slightly invasive. All right?
Get away from my cheese. Come on.
Is that Elizabeth? Who's yelling at their cat or something? All right. An amoeba may secrete enzymes that dissolve tissue and penetrate into the layers. All right. And then if you look here, again, maybe you guys can't see it, but it's literally eating through. You can see that blood. All right. And by the time that gets to your digestive tract, that's going to be black. It's going to be tarry. It's going to be occult. It's not going to be real red, because it's in the intestinal tract. So it's going to be partially digested by the time you excrete that. All right, and these can actually make, they can grow into these great big wads like tumors. Does it sound gross enough yet? Mainly the liver and lungs. Right? And like I said, if it gets into your lungs, it can get into your blood supply, it can go anywhere it really wants. Right? All right. Does everyone see this word azole in here? So when you're talking about a lot of these mycotic issues in chapter 22, or some of these great big eukaryotic cells, anything that ends in azole is usually good for big eukaryotic cells, or a lot of these molds, which are eukaryotic too. So anything that's eukaryotic, they usually hit it with azole. Anything that ends in azole, just to keep in mind. All right. So amoebic infections of the brain. We talked about amoebic dysentery of the digestive tract. Now, these are worse because these are amoebas, and what the problem is, once they get into your brain, they cross into the central nervous system. They literally start attacking your nervous tissue. All right, so people can have severe nervous system issues. And I said before, these are ordinary and inhabit standing water. So they'll give you a case study of somebody, Boy Scout, Girl Scout camp, family swimming, somebody injured themselves, injured their eye or injured their nose, and they're going to assume if these amoeba got into the eye or the nose and it wasn't a far ride to the brain, and they burrow into the brain, and they can have these major problems. And you have to remember, like, once it's in the brain, you really can't get rid of it. Right? Primary acute meningoencephalitis. Doesn't sound good, right? Inflammation of the meninges is acquired through nasal contact with water or traumatic eye damage. Infiltration of the brain is usually fatal. They'll start losing cognitive function, right? And once it's there, they really can't, there's no way of treating it. So these enter through cuts or scrapes or the conjunctiva, or rarely through inhalation, right? This can cause keratitis, right? Inflammation of the cornea. Right? And I've only seen one of these in clinic. Somebody had literally was eating away at their cornea. It was really, really gross and extremely painful. So if you guys have ever scratched your cornea, it hurts like beyond words, but your cornea, you know, if you keep that eye closed and don't move it up, and, you know, don't have your lid open and closed, your cornea generally will heal in 24 to 48 hours, all right? And it's avascular, so there's no blood supply. It's when you start cutting the cornea or the conjunctiva or the sclera that gets into the blood supply, it's a real problem. Algeria filari is an infection occurs when swimmers inhale contaminated water. So if they give you a question about somebody having eye damage, that put their eye, I could say their nose damage or whatever, that's Anketh Amoeba, right? If they inhale water and they start having symptoms, it's Naegleria filari, right? That's the difference. So if it's something with an eye injury, it's always going to be Anketh Amoeba. If it's inhaling water, like let's say they were drowning, or they were playing a game and they inhaled a bunch of water, that's going to be the answer. All right, and ventilating, if they ask you this, it's the only Cholera is the only ciliated amoeba, so it moves by cilia. Nature cilia brings all the food inside the body, which is the feeding stage. And this doesn't have an intestinal problem. They're going to say something about they were dealing with pigs or horses or some kind of domestic barn animal, usually. If they give you that kind of a question. All right, healthy humans are resistant. So the person would have to be like maybe a non-compliant diabetic or organ transplant or something. They'd give you something where their normal immune system might be slightly compromised and they were around grazing animals, usually, like I said, pig or horse is what they generally ask you, weird things like that. All right, so let's talk a little about Trigomonas. You guys ever heard of this? Yeah, my microbiology teacher in grad school was obsessed with chancres and Trigomonas. He was a sick man. All right, so these are small, pear-shaped, all right? And they're gonna have 4 interior flagella and an ungulating membrane. All right, so this is gonna look a lot like Giardia. Have we talked about Giardia yet? Not today, right? Okay, so Giardia is gonna look just like this, but Giardia is gonna have 2 nuclei. It's gonna look a little bit different, and it doesn't have 4 flagella. So that's how you're gonna be able to tell the difference. And Giardia is going to be a gastrointestinal issue where it has like this plunger type structure that literally attaches to your intestinal walls. It exists in a trophozoite form. All right, trophozoite form again means
Eating and like feeding.
Yeah. Active eating. Yeah. So there's 3 infect humans: Trigomonas vaginalis, Trigomonas texas, 10x, and Trigomonas hominis. Right? Usually hominis means, if they ask, I don't know why, just what that word means. All right, so Trigomonas vaginalis causes sexually transmitted infection called Trigomonas ACA. All right, reservoir is human urogenital tract. So this is a STI. It's transmitted in the urogenital tract because it's mucous membrane. All right, here's the issue. 50% of infected people are asymptomatic. They don't even know they have it, right? But if a female has it, usually, I know this because my micro teacher went over and over again. They will have itching, foul smelling discharge, urinary frequency, green to yellow discharge. All right, that's if they're symptomatic. All right, so strict parasite cannot survive long outside the host. All right, and there's 3 million cases yearly. All right. Males, however, they don't really have that many symptoms. They might have inflammation of the ureter, thin milky discharge, occasionally a prostate infection, but most men asymptomatic. And if they had that thin milky discharge, they would think nothing of it. Just because then it looks like seminal fluid. They're not really, oh, there we go. So that's what it looks like. I had to throw that in, sorry. Get ready to vomit. You guys, well, the problem is at the end, I don't think the tapeworm getting pulled out of the guy's nose is going to play for you guys. You have to play it on your own.
Snap, crackle, and pop. Darn.
You got to play it. All right. So once again, these are flagellates, and they can't live on their own. It's passed back and forth. But this is another one that can't live on its own. You can get it from sharing latex toys. So clean them off if you're going to share them. All right. So Giardia looks just like this. All right. Except very similar in shape. Things are a little bit different. So Giardia doesn't live in your urinary tract. It likes to live in your intestinal tract. Causes giardiasis, common gastrointestinal disease in the United States. Ingest cysts in contaminated water or hands. And the problem with this is you can kill it with boiling water, iodine, but people usually get this from drinking out of a fresh stream. Like you're camping or whatever, you're in Montana, everything looks beautiful. You want that, fresh spring water. It's in there. It's been shed. I'm being recorded. I can't say that other word. It's been shed by some wildlife. It drained into the water, right? And you consume it, right? The problem with this is it's not shed constantly. It's shed very intermittently. So you could go in and say, you know, if I was bloating, diarrhea, vomiting, fever, you know, it's different than the flu. I feel really bloated. Right? Oh, well, let's take a stool sample. Nothing shows up. You take another stool sample a week later, maybe something shows up. So here, this is Giardia. Now, if you look at this, it looks kind of like Trigomonas, except it doesn't have the 4 flagella up here. It doesn't look cute. It's got 2 little eyes and a little nose. All right. Here's the side view. That thing right there is like a plunger that literally attaches to your intestinal wall. All right. Cysts are small, compact, and multinucleated. Reservoirs include beavers, cattle, coyotes, cats, and humans. Cysts can survive for 2 months in the environment. This generally going to get it from country water supply, waterfall or something, and you're going to be around some kind of wildlife. And just remember, these cysts that are excreted by the human or the cattle or coyotes, they can live 2 months on the outside. So they can be shed into the water stream at any point in time. Right? So if you're going to go camping, boil your water, iodine packets, reverse osmosis. There's like, you can get ceramic filter for this. Right. Usually ingested with water or food. It only takes 10 to 100 cysts to enter the duodenum for them to multiply. And usually, like I said, this is diarrhea, abdominal bloating, sometimes fever. And the other key is diagnosis is difficult because organism is just shed in the fetus intermittently. So boiling, iodine, ceramic filters, reverse osmosis, something like that. All right, so hemoflagellates. These are vector-borne blood pairs. What is hemo usually going to mean? Yeah, blood. These are flagellates. And these, we're going to see a picture of this. These things are huge. So when you see a red blood cell, they're going to be 2 to 3 times the size of a red blood cell. And unfortunately, you guys don't get a lab file. I'd love to put a slide of this on a lab file because it's so huge. Right. Obligate parasites live in the blood and tissues of human hosts. Right. Once again, these can't live on their own. They have to get into our cells to produce ATP and stuff. They can't do it. Right. Cause life-threatening and debilitating zoonoses. Remember, that's animal-borne. Spread in specific tropical regions by blood-sucking insects that serve as intermediate hosts. Right, so we were talking about malaria. Have you guys heard of the Panama Canal? Maybe heard of Panama? All right, so back in I think it was the 20s and 30s when we actually went to dig that, there was malaria down there. We literally went in and got rid of the female Anopheles mosquito there. All right. But you can get this in South America and other countries. So I'm not saying, don't we have like killer hornets or something? Killer bees?
It's like that.
Yeah. So we have COVID, plague, lotus, killer hornets. I don't know what's going to be next. My guess is we'll have some malaria next. Awesome. All right. Have complicated life cycle and undergo morphological changes. So we'll see this. They're going to be injected into the human. Sometimes they go to the liver. They go through skinogenies. They change shape and they leave there. They go into red blood cells. Red blood cells erupt. Person has cycles 48 to 72 hours of anemia and sickness. And then some of these Macedonian go into other cells. The female Anopheles mosquito ingests those in her next blood meal, and they go into her abdominal cavity. Then she sort of regurgitates them into her salivary glands. And the next time she bites the next person, she bites that person. And as she's biting it, she secretes anticoagulant to keep the wound open, and then she injects you with trophozoites. Very complicated life cycle, but we don't have to really worry about that. Like I said before, I'm not going to ask you this, but if you ever see mastigo, it's just telling you the stages. So A always means none, right? O means it's not quite there. Api always means on, and tropomastigote is a large fully formed stage. So when you guys are taking your board exams or NCLEX or whatever, I know I'm giving you a lot, but I want you to start breaking down what these things mean. So, A, like I said, means none or never or not. Pro means it's almost there, it's starting. Api always means on or next to, all right? And tropomastigote is the fully formed stage. So here's a trypansomia. All right, so these are distinguished by their infective stage. All right, so these are going to be elongated spindle-shaped cells with tapered ends, eel-like motility. So when you see these, like I said, they're going to look like eels, but when you look at them next to the red blood cell, these things are absolutely massive. Right? Trypansomia brucei causes African sleeping sickness. Right? Trypansomia cruzi causes Chagas disease by the red blood bug. And this is the one that, like I said, that will land on you while you're sleeping. It lands on your eyelid or your lip. It's drawn in by your carbon dioxide. And once again, if you're type O blood, they love, don't ask me why, but people with type O blood get bit by mosquitoes or these bugs, or they're more prone to H. pylori. We don't know exactly what it is. Probably has to do with the antibodies are not having the antibodies. We're not really sure. All right, African sleeping sickness. All right, the problem with that, why do you think these people would have, I'll just tell you. All right, so African sleeping sickness, these people literally pass out during the day, all right, because this causes neurological damage. These actually, if it's untreated, goes to the brain, causes a lot of central nervous system problems. They're up all night, but they sleep during the day. That's why I got this name, African sleeping sickness, caused by the tsetse fly. Right? And I think that's going to be one of the questions on your exam. So if you get one of those, super easy question. Right. So Trypansomia cruzi causes Chagas disease, endemic in Central and South America. So when I went to Peru, I was like totally afraid that I was going to get this because every place I went, not a screen to be found anywhere. Freaked me out. All right, carried by possums and armadillos are the primary reservoir. All right, the other weird thing, we didn't talk about Yersinia pestis, the plague. All right, it's one of those things that's, or leprosy is the other thing that's carried by armadillos. I know it's just weird, but I've seen that question asked before. Transmission occurs through bites of insects. The kissing bug, red blood bug, feeds preferentially from blood vessels in the lips. Right. Why would it pick that, do you think? Lips or your eyelid? Why do you think?
Because they're so superficial.
Exactly. Yeah, it's superficial. It's just super easy to hit your lip. And once again, I said it's drawn by your CO2 that you're exhaling. Same as mosquitoes, right? So it picks up the CO2 concentration in the air, and it lands right there, bites your lip because it's super easy to penetrate that. Right? Literally takes a dump when it bites you, all right? And then you scratch that bite and you put the feces into your blood. Now you've inoculated yourself. Right? Infection occurs when bug feces is inoculated into cutaneous portal, local lesions, fever, swelling of lymph nodes, spleen and liver, all right? And you look at the size of this thing. Probably doesn't look really big there, but a red blood cell is about that big. This thing is absolutely huge, right? So reservoir is the armadillo or the possum. This bug's gonna bite them. All right, we just happen to be an incidental host. They bite us, right? Yeah, if you see this woman, this poor thing, she got bit on the eye. Right. Look at the size of this thing. It's huge. Imagine that thing biting you when you're sleeping. Oof. Yeah, this thing, it can affect the heart muscle, right? Chronic inflammation occurs in organs, especially heart and brain. Right? Not as bad as African sleeping sickness, but literally it affects these muscles, and it starts in the blood. There's a lot of blood supply there. It starts replicating in that area, causing these great big nodules. Right. Here's a tsetse fly, causes African sleeping sickness. All right, and this is the one that generally gets into the bloodstream. And look at the size of this thing again, huge. All right, and this goes untreated. It starts causing major neurological problems. And this is when these people literally go to sleep during the day. They're up all night if it's not treated. These things can be treated if they treat them right away. But in these other countries, go away for a short period of time. And these young kids don't have any symptoms until they get older. And by the time they get older and these things happen, it's too late to treat it. The minute it goes into the bloodstream or they start living in your heart, you can't get it. Right? So there's literally the size of these things, and that's a red blood cell. So they're huge. Right. And roots kissing disease is another one of these that actually changes its glycoproteins. Another one of these things that goes in, changes the glycoproteins on the hemoflagellate, and now we don't have any antibodies to it because the kid's constantly changing it. That's how it can invade the immune system. So, you know, if our eosinophils would go in and kill it, we would. The eosinophils would go dock next to it. We'd get 100 eosinophils going in, taking a bite out of this thing and injecting it with lysosomes and everything. Eventually we'd kill it. But it literally goes in and changes its glycoproteins. So a little about Leishmania. All right, Leishmania causes Baghdad boils. It's usually around the equator. All right, not many cases here, except down the street from me, there's this building called the VA. You heard of it? Mm-hmm. Yeah. So a lot of people that are coming back from Afghanistan or other countries are veterans. If they've been bit by these sandflies, they get this. Right? Causes Leishmania, endemic in parts of the tropics and subtropics. Wild and domestic dogs and small rodents are common hosts. Right? And these people will get bit. Right? But this is usually subcutaneous, or it's cutaneous, all right? It's at the lesion, it's in the macrophages. If the macrophages don't migrate, it stays cutaneous. It's if the macrophages have the hemophiliate in them, this thing is huge. If it's a macrophage, the macrophage, like I said, can go anywhere it wants. And it's one of these other hemophiliates that tricks the macrophage into engulfing it. Now it can go anywhere it wants. If it gets into the bloodstream, it can go anywhere it wants, and it has a propensity for the heart. Right? But these will have superficial wounds first, and we'll see, I think, 2 pictures of it. So if they treat this right away, it's not going to go systemic. It's when they don't take care of it that it causes a problem. Yeah, it's caused by the sandfly. This is the equator regions. This is only around the equator. What do you think the temperature is like on the equator?
Hot and humid.
Hot AF, yeah. So this thing can't live anywhere but where it's super hot. And then it just has 2 stages, promastogotes and amastogotes. Right. Cycles. All right, and that's what it looks like. This is called a Baghdad boil.
Okay.
You don't think you'd miss that, would you?
You know, some people probably do.
Oh, it's about a flesh wound. Yeah. Isn't that from Mighty Python? No, you guys are too young.
Oh no, I know that.
This poor bastard. You think mom would take him somewhere?
Depends.
Yeah,
She's just gonna take a picture.
I know. I always find the most horrific picture for you guys. Just to give you a little, you know.
I join it.
No, the worms are my favorite, but anyway, whatever can gross you out. All right, so let's talk about some of these Complexion parasites. So this has to do with their shape or their cycles. All right, so these are sporozoans. All right, so literally they make like spore type cysts. I know it sounds weird, but that's a survival mechanism. So these lack locomotive organelles and the feeding stage, all right? But these alternate between sexual and asexual phases, right? Most form specialized infective bodies that are transmitted by arthropod vectors, food, water, other means. So Plasmodium, malaria, all right, transmitted by mosquitoes and the female Anopheles mosquito. Toxoplasmodia. All right, what does that sound like? You guys heard of this? Carried, if mom is pregnant, you shouldn't be changing the cat litter. All right, this is carried literally by eggs, aerosol. You know, they say it's in cats. Cats are excreting it. And if the cat litter, mom cleans it off, she's inhaling the aerosol or the eggs. All right, but literally, if your cat never leaves the inside and you don't have any mice in your house, there's no way your cat's going to get it. And Cryptosporidium is excreted by coyotes and animals in the wild. And there was a problem with this in Milwaukee in, I think, 90 or 94. The water supply got infected there. They don't know how, whether it was runoff from a farm or somebody had it and they excreted it in the water supply. But Milwaukee literally had to change its entire water system because about 500,000 people died. Way more people than COVID-19 killed a lot of people. A lot. A shit ton. Right. All right, so these are protozoan parasites in humans. All right, so protozoan, these are large parasites. Right, and usually in animals. Life cycle involves at least 2 types of host. All right, what is schizophrenia? Can we call it that anymore? Or we have to call it bipolar. All right, schizosyny means more than one. Is a major feature of Complexion life cycles. Multinucleate schizons form before the cell divides. Schizosyny are asexual reproduction. All right, so that word's going to come into play when we talk about Plasmodium. The female Anopheles mosquito is going to bite you. It's going to be in your blood supply. The schizosyny is going to get into your liver cells. Right? In your liver cells, it starts multiplying. Right? After a while, it makes a whole bunch. All right. Then it goes into your red blood cells, multiplies in there, changes form. Those burst. All right. So every 48 to 72 hours, you have anemia, fever. You cycle through that, and then other forms of this are going to go into other red blood cells that the female Anopheles mosquito is going to consume in her blood meal. And she's, like I said, she's going to pass that on to the next person she bites. So Plasmodium is a causative agent of malaria. There's 4 species. All right. Falciform, as far as I know, is the most deleterious or most pathological. Right? And there really isn't a whole lot of drugs that are that useful. Quinine is still used, and that's been used for about 400 or 500 years. It comes from bark of a tree, and it's still almost as effective as quinine or some of these other drugs that we're talking about here. Well, there's endemic throughout the tropics and subtropics. Anopheles mosquitoes are vectors for Plasmodium. And Plasmodium life cycle has 3 prominent stages. So if they ask you about malaria someday, it's going to be Plasmodium, all right, female Anopheles mosquito. We're going to talk about like cycling. Like I said, 48 to 72 hours is going to be cycling. They're going to have anemia, fever, because remember, their red blood cells are bursting. These are growing. After they leave the liver, they're going to the red blood cells. they're multiplying there. They get so big, the red blood cell literally bursts, right? And we're bursting hundreds of thousands of these, all right? And remember, red blood cells don't have a nucleus. They can't replicate on their own. They have to, every 120 days or so, they replicate because the spleen gets rid of them, right? So if you are you're anemic or you have diminished red blood supply, how does your body know to make more red blood cells? There's an enzyme released by your liver. Nobody remembers. Erythropoietin. Not familiar? No, it's not in micro, but anyway. So here's just showing you where this is taking place. And I said before, we used to have it here until we got rid of all the female Anopheles mosquitoes. All right. But here's a huge fact, 300 to 500 million new cases each year. 2 million deaths each year just from malaria. Right? All right. Does anyone know what sickle cell anemia is? Anyone heard of it?
Yes.
Having that give you like an advantage over malaria, because I thought I read that somewhere.
It does, because what happens is your red blood cells, when you are when you have low oxygen concentration or you're overworking, hemoglobin B changes shape, and the red blood cell goes from round to sickle shape. All right, so it can't survive. So the sconogenes don't have a place to multiply. The problem is, if they're sickle shaped, they get jammed up in the capillary bed. Right, so you'll probably survive malaria, but you'll die from necrotic issues from your capillary beds being destroyed, and your heart and muscles and organs, kidneys can't get a whole lot of blood. So yeah, it's good in one way, depending on how severe if you have a mild case of it, or only one parent has the trait, you are usually fine, but it depends on the degree of sickle cell that you have. All right, so just all that I need you guys to kind of remember is it's female Anopheles mosquito. It goes to the liver first, right? From the liver, it leaves there. It goes to the red blood cells, multiplies there. These will erupt. That's what causes a sickling. These cells here, they'll divide. You'll have like a male and a female. The female Anopheles mosquito ingests those. They go into her thoracic cavity. They reproduce there sexually. They go to her her throat, and then as she takes her next blood meal, she secretes them into your bloodstream, and now you have this. They'll go to your liver, and it'll start the whole cycle all over again. Yeah, it's in there. There's a video on it if you want to see that. All right, so for any of the plasmodiums, any types of malaria, they're going to give you, person's going to have symptoms include episodes of chills and fever, sweating, anemia, and organ enlargement. That's always every case they've ever seen. There's going to be some kind of episode, chills and fever, symptoms every 48 to 72 hours as the red blood cells rupture. And like I said, your liver has to secrete erythropoietin constantly to reproduce these red blood cells. Falciform, like I said, is the most malignant type. Right? And diagnosis is they have to, when they do the blood, they're going to actually find these trophocytes in your red blood cells. Right? Increasing drug resistance, like I said, quinine is still used. It's been around for 400 or 500 years. So really don't have anything much better than that on the market. All right, toxoplasmosis gondii. So if you hear about toxoplasmosis, it's going to be a case study about a woman. She's going to be pregnant. It does not going to really affect her. will be vertically transmitted to her fetus. It can kill the fetus, or the person is going to be immune compromised, right? Wild or domestic mammals and birds are the major reservoir. Cats are the definitive host. All right, so they actually, it replicates in the cat. The cat excretes these into the soil. Mom picks it up from a kitty litter or undercooked meat. She's ingesting or inhaling it, and contaminated soil can occur. But remember, if this cat never leaves the house and is not in contact with domestic bird or mouse or whatever, there's no way it's going to get it. But I've seen the question. Yeah, it's just showing you here. The cat's going to pick it up from a mouse. He's the definitive host. He's going to excrete it into the litter box. Mom's going to pick it up, acquired by ingesting raw meats or substances contaminated by cat feces. Yeah, so it's going to be severe in two populations, AIDS or immune compromised, or fetus, because it's transplacental or vertical transmission. Cryptosporidium, if they bring this up, it's going to be an intestinal pathogen, right? Infects a wide variety of mammals, birds, and reptiles, right? And what happens is, once again, these are going to be in the wild. They're going to be excreting this into the water supply. You're going to consume it, and then you're going to get sick. Usually, once again, these people are immune compromised. Something's going on, because usually you can just flush this out. In the 1990s, yeah, it was more than that, but it was like, I think it was 94, and there was like 500,000 cases in Milwaukee. They had to literally, like I said, they redid their entire water system for this. Infection usually results from drinking contaminated water. Fecal oil transmission causes severe diarrhea, accompanied by headache, muscle pain, cramping, fluid, and weight loss. So a lot of people mistake this as a flu. Usually it's not self-contained, it's you can get rid of it just by flushing it out, I guess is what I want to say. Yeah, so you're going to pick up these oocytes and the water, right? And these literally, if you look, they literally attach to your intestinal wall. Right? Let's talk a little bit about some worms, and I think that's it. Right. So some of these are macroscopic, multicellular eukaryotic worms. So these things literally are huge. You're not going to, even the smallest pinworm, you're going to be able to see it's going to look like a piece of rice. All right, you can't miss these. Intermediate hosts are often needed to support the larval stages. All right. There's three different categories depending on their shape. They're roundworm, hookworms, if they're segmented. I don't care if you know that, but it's in your book there. All right. Does everyone know what a hermaphrodite is?
Both sexes.
So some of these worms can be hermaphroditic. They can reproduce on their own. Some of them are asexual. All right. So adulthood and mating occur in the definitive host. So you guys are usually the definitive host. Adulthood and mating occur there. Larvae occur in the intermediate host. So sometimes we can excrete these, or if does anyone here eat sushi? How about watercress, seaweed? Well, sometimes these snails are the intermediate host. They literally excrete larvae onto watercress, seaweed, some of these aquatic grasses, and then they put it around your sushi. Yum, yum. Get your sushi at the gas station or wherever. You might be suspect. I'm just saying.
A little bit.
Yeah. All right, so let's talk about a few things. All right, so here's usually the life cycle of this. All right, so most of us are familiar with cycle A. Larvae enter the tissue, you're consuming it. They get in your digestive tract, they make eggs, you excrete them. Someone picks them up under their fingernails or in water, whatever, right? Cycle B, these literally are in the soil. you step on them, they get into your hair follicle or burrow through your skin, and then they get into your intestinal system, and you can they reproduce inside you that way. Or you guys have probably heard of, I know day one I talked to you guys about tapeworms. Remember? So you can either get Trigomonas or tapeworm, beef or pork. Yeah, that way it usually likes to insist in muscle. Right. So make sure you're cooking everything. Don't eat raw beef. I eat raw hamburger, but that's just because I'm weird. All right, but you don't want to eat this. All right, we don't have a problem with it here generally. The problem you have is if you're in the South Midwest, all right, and your meat might be coming across the border from Mexico, or your meat might be coming from this country called China, where they might not have as many ethical, what do they call that? Animal husbandry rules that we do. You might get it. So you got to make sure you cook this. All right. At the end of the PowerPoint, if you guys want, there's a video, and it's a real video where they took pork chops, and they poured Pepsi on them. Right? And the Pepsi, actually, you know, Pepsi will eat through paint, or they'll take rust off a bolt. It actually uninsists the eggs and the larvae. And what do you think came calling out of the pork chop?
Ew.
Yep, I'm not kidding. Real, true, honest to God video. You can see it. They left it in there.
Where's the pork chop from?
They didn't say. It didn't come from, probably didn't come from Dashes. Maybe Market and Square. I'm not sure. It didn't come from, I don't think it came from Western New York. It probably came from Mexico or Texas or someplace sketchy, or, but you know, you could try it. It's not going to hurt. It's a for real thing, honestly. All right, so we'll talk a little about helminthes. These are pathology arises from worms feeding on or migrating through tissue. So literally, you're consuming them, like I said, and if there's cysts, when you consume them, the pH in your stomach is low. There's acid. It dissolves the calcium. These uninsist, they go in your duodenum. Like I said, your pancreas is going to secrete some bicarbonate, which change the pH. They get into your intestines. They can start multiplying, replicating, or some of these, like roundworms, lumbricoides, Ascaris lumbricoides, they like to get into your bloodstream. They get into your lungs. They replicate there. Then you cough them up. And then if you don't spit them out and swallow them, or spit them at your sister or whatever, you swallow them and you start the whole cycle all over again. Diagnosis is based on blood cell count. Remember, your eosinophils are going to be elevated with any kind of large parasitic eukaryotic cell. So if you're not feeling well, or you go to read someone's CBC differential and the eosinophil count's elevated, you have to rule out allergy or some kind of large parasitic something. So were you eating sushi? Did you leave the country? Were you on a cruise ship? Were you in China? Were you in South America? Did you not cook something? Something's going to give. We do serological testing. You know, we can check for eggs, larvae, or adult worms and feces. That's a shitty job, but someone's got to do it. And if you have a tapeworm, you want to get rid of it, it's going to be dropping off segments. You can't get rid of it until you find that scolex, the head of it. So you have to literally sift through someone's feces until you find the head of that tapeworm, right? And you guys might think that's gross, but in the 20s and 30s, that was a weight loss treatment. You could actually go and get beef tapeworm, right? And there are many rumors of certain people on the West Coast in this place called Hollywood who need to lose a ton of weight in a very fast time, who have been rumored to have taken beef tapeworms, right, to lose that weight. And then you have to take the medication to paralyze the tapeworm, let it let go, and then excrete it, right? So before they had that, if you had a tapeworm way back in the day and you wanted to get rid of it, they would literally leave you there almost dead, and the tapeworm would crawl up your throat, out your nose or out of your mouth, looking for food. Grossed out enough? All right, so these drugs that work on worms are either going to slow the metabolism of the worm, or what we generally like to do is kind of paralyze it so it can't move. And if it's attached like a hookworm, it's attached to your digestive tract, or tapeworm, it'll let go, and then you hopefully will excrete it. All right. If you have, the problem is if you have a large worm load like Lumbricoides, Ascaris lumbricoides, you could have something the size, both of your hands. So you have to excrete that, and sometimes you have to go in surgically and have it removed. You can't pass it. All right. So roundworms are Scoides lumbricalis, and we'll see this coming up. All right, and they can infect the intestines, and like I said, these worm loads can be so large they can actually bind up your intestines. Ascaris lumbricoides, large intestinal roundworm. Most cases in the U.S. occur in the southeastern states. All right, what do you think of your occur more down there aside from temperature? These people walk around with no shoes on. Sometimes in the very rural areas, if on their hands, they don't wash their hands as often. Probably in Alabama or Florida Bama line or something like that. I don't know. I was in Alabama. It wasn't that bad. All right. Ingested eggs hatch into larvae and burrow through the intestines into circulation. So one of these that travel to your lungs, and you swallow them. You cough them up and swallow them and start the whole cycle all over again. And if you're a healthy adult and you're having these reproduce in your intestines, you can shed 200,000 eggs a day. Right? So, if you're excreting it, if you're, using an outhouse or something, and things aren't quite as sanitary as we might like, you can pick one or two of these up, and if you ingest them, right, there's a picture of literally, no kidding, gross, right?
Oh,
Yeah, allergic reactions can occur because remember, this is a pathogen. It's very, very large, and the outside cutex of this worm is very foreign to your immune system. So there's a lot of antigens. So your body's going to make a bunch of antibodies to it. All right. But antibodies aren't going to really affect this because as eukaryotic, it's huge. You need a lot of eosinophils to get this. The problem is these are so large, they reproduce so quickly, your eosinophils can't possibly get rid of that many. No way. Heavy worm loads can retard physical and mental growth. So if you're a kid and you have these growing in your body, you can't eat enough to keep the worms alive, and you're going to have failure to thrive. And there's other things called whipworms. Right? And we'll see a picture of this coming up. These literally pierce your capillaries, cause local hemorrhage. These are really, really tiny. Right? Heavy infestations can cause dysentery, rectal prolapse, and can be fatal in children. So what's rectal prolapse? Yeah, your rectum literally comes outside of your body, literally. So there's so many, when you go to excrete them, the tube comes out. You guys going into healthcare? Yeah. Not anymore. All right. Oh, these right here, Entamoeba vermiculus. All right, these are pinworms. All right, anyone want to guess what that is? Yeah, exactly. Most common parasitic worm found in the United States. These are the only host, entero, digestive. Female pinworm deposits their eggs on the anus at night, right? The person doesn't feel it inside the body. It's just when they deposit the eggs and the worm comes out that it causes the itching. So they go to itch the perianal region. It gets under their fingernails. And like I said before, self-inoculate themselves, or they go to touch their sister or toys or reach in the cereal box, and then they infect the whole family. Let's see. Yeah, eggs are picked up from surrounding and swallowed. And this is relatively big in daycare centers, and sometimes you can get them from shopping cart handles and toys. Like toys in daycare centers are huge for this. Anal itching occurs when mature female emerges from the intestines to release the eggs. And does anyone guess how the tape test works?
You told us.
Yeah, just lift the leg, put the tape on there, you pull the tape off, and you look to see. Now, these are the nasty ones. These are hookworms. Everyone see this here? These literally have hooks, and they have like scissor-like teeth, all right? Nectar americanus, all right? These came over on a ship from Europe. And I said before, these characteristic hook, curved ends and hooked mouths, these literally burrow into your intestines to hook on. And I said, these things can drink a half a pint of blood a day if you have a big infection. Humans shed eggs and feces, which form into filarial larvae, right? Like the filarial worm from elephantitis. They burrow into the skin of bare feet. All right, so if you're down south or wherever, you got to make sure you wear shoes. When I was growing up, my mother always made us wear shoes, and I said, why? She said, it's the only way the neighbors knew I was civilized. But yes, we had to wear shoes on the farm. Not that we had hookworms there, but anyway. All right, so hookworms are the second most common nematode infection. All right. Enocyclone duodenum, where do you think those guys live? Duodenum, very good. And Nectar americanus. Larvae and soil burrow through the skin. They travel to the heart, lungs, and eventually the small intestine. Burrow in your skin, get to your heart. They circulate in your heart. Remember, your right atrium, right side of your heart goes to your lungs. They go to your lungs. There, they can get into any capillary bed they want. All right. They travel to your small intestine because it has the richest blood supply, believe it or not. Because you got all that food and nutrients there. Adult worms suck the blood from their host, all right, causing chronic anemia, iron, and protein deficiencies, because these are literally sucking the life out of you and your blood and all the nutrients. All right, ground itch occurs at the site of larvae penetration. So as these larvae, remember the worm isn't going into your skin, you're secreting the larvae in your feces, all right, it's on the ground. These larvae are tiny. As you're walking, they're attaching to your foot, and they can burrow into a hair follicle, or they can burrow into a cut in your foot or wherever. And then they get into your bloodstream, go to your heart. From your heart, they circulate to your lungs, and they go into your intestinal system. Look at that guy. He's slightly magnified. It's not really that great. Katerina, you look like. All right, so it's not these hookworms.
Asking to come to dinner.
Right? Like, what's for dinner?
Me.
Yeah. All right, so blood loss is significant with these. Just remember these. They burrow into your foot, they go to your heart, lungs, intestines, and they drain your blood. These are the ones that can travel up your lungs. They can travel up your lungs again. There's another one you can throw. You can spit up, and you can swallow and re-inoculate yourself all over again. All right. So Trigonella or Trigonosis. All right, have you all heard of Trigonosis? No? All right, another one of these worms. This is not a tapeworm. These are other worms, but these also insist in muscle. All right. With Trigonosis, they love two muscles particularly. Well, three. They love your diaphragm, and they love your eye muscles. Your eye muscles are very, very small. They can get there very, very easily. So usually the first sign is you have problems with focusing your eye, because you know that you guys have 6 eye muscles, right, that move your eye. the problem with that, and then it starts to burrow in your diaphragm. You have some trouble breathing. If it burrows in there enough and your diaphragm doesn't move very well, you die. Uh-oh, somebody's not happy. All right, acquired from eating undercooked pork or bear meat. I've never heard of a case of bear meat, but apparently it happens in the wild quite a bit. Larvae migrate from the intestines of blood vessels, muscle, heart, and brain, where it forms cysts. And remember, with this and the other pork tapeworm, once it gets into your brain, there's no way of treating it. You have all kinds of neurological problems we can't fix. Right? First symptoms are flu-like diarrhea, so people don't even know they have it. Second symptom, muscle and joint pain as these things start burrowing in your muscles. Right? Shortness of breath because it's burrowing into your diaphragm, causing it to not, it's going into the muscle tissue. Your diaphragm doesn't work properly. No cure after larvae has insisted. So once it leaves your digestive tract and it's insisting in your muscles, we can't get rid of it. And the worst, like I said, worst case scenario is it's in your brain. There's no way that that's going to cause neurological problems. Right. Now, filarial worms are what causes elephantitis. Right? So these are elongate filamentous bodies spread by biting arthropods. Right? These cause chronic deforming diseases, and we saw a picture of this before. Cholera bancrophobia causes elephantitis. So these filarial worms get into your bloodstream, and they get into your lymphatic system, and they block up all of your lymph nodes. So now you have no way of getting that extracellular fluid that didn't quite make it back into the capillary bed back to your lymph nodes, back to your subclavian or your the left side of your I can't think of it. Right subclavian or left thoracic duct, or yeah, thoracic duct, back into your heart. All right. River blindness is caused by black flies. They bite you, causing worms infestation. And at the end, there's a video of the Loa eye worm. This woman literally got bit by a worm, or by the Loa fly. Had the eye worm. Had stabbing eye pain, major headache. She almost wrecked her car with her husband in it. Then, like 2 weeks later, she had this massive, severe headache. Then she looked in the mirror and she literally saw the worm in her eye. And then she decided to go to the doctor. Like, I would have, so dumb when you see the video, you would want to slap the stupid right out of her, but it's there. You guys want to see it. So Cholera bancrofti causes elephantitis. It's a tropical infection spread by a mosquito. Anopheles mosquito spreads this too. All right, so malaria and this. Same vector, female Anopheles mosquito. Chronic infection blocks blockage of lymphatic circulation and elephantitis, massive swelling in the extremities. We'll see a picture coming up. This person has a severe case. The legs are completely swollen. You'll notice they can't even fit into their shoes. Right? They didn't do anything about this. But he is having a cigarette, though, I think. You see the picture coming up. Well, at that point, what else do you have to live for? Right? Yeah. Transmitted by female culex and Anopheles mosquito. Mosquitoes ingest mycofilariae when feeding on a human. Mosquitoes then transmit the parasite to a new individual. Remains asymptomatic for years, and then lymphatic damage can result in elephantitis. Problem is, these people start having, they start having symptoms 5 or 10 or 15 years later, and it's so gradual they don't really do anything about it. But if they went in for a blood test, we'd see their eosinophil count was elevated, right? And then we'd go in and check for antibodies, or we check. We do an ELISA test or check something to find it. But a lot of these happen in very, very rural areas, or these people don't believe in doctors. They don't want to go to the doctor. They think it's nothing, and they have this. All right, so there it is, right? But look at how big this thing is. All right, so you got to imagine if you had, let's just say you had 100,000 of these and they were traveling around your body, asymptomatic, but after a while they got into once they get in, they curl up, they can't get out. Because remember, we said there's all those afferent vessels going in. There's only one efferent going out. So these get blocked up and the lymph nodes, they can't go out. And these people have enlarged lymph nodes for a while. They don't do anything about it, and we can't get rid of them. That's pretty, isn't it? She's got her big toenails painted though.
Girls gotta look good.
Girl's gotta look good. Looks like a baby
Pictures
rhino.
being taken.
Yep. Yeah. So there it is. All right. River blindness, if they talk about this, I don't think I asked you about it, but it's transmitted by black flies. Usually this is around Mississippi region, right? Adult female migrating via blood to the eyes, provoking inflammatory reaction. It's called river blindness. So it happens around the Mississippi River. They get bit by a black fly, they kill it, they don't think anything happens. Start getting some headaches, migrates, they have some inflammatory reactions in the body, goes to the eye, and it causes major blindness. All right. Here's one that's super gross, the Loa African eyeworm. Spread by bite of small flies. Temperature-sensitive worm migrates under the skin and may enter the eye. All right, so these do not go deep because like leprosy, it likes to be superficial because it doesn't like that massive heat. Treatment is pull the worm from a small hole in the conjunctiva. All right, so you'll actually see this ophthalmologist goes in with a slit lamp, goes to look in, sees the worm. He cuts it, grabs the worm, and he literally pulls it out. Right? Or there have been cases where they put the worm around the where you thread a needle and they turn it and they pull the worm out. The problem is if the worm breaks in half, then the other half takes off. So you got to make sure you pull it nice and slow and you get it all the way out. Now in the video, they're going to pull this worm out. It's 7 inches long. She did this thing for months and did nothing about it. When you see her talking, you'd be like, this girl is dumb as dirt. All right, I think we're almost done here, guys. All right, so flukes. All right, so these are named after the area. So have you guys ever heard of Chinese liver flukes? No. All right, so these are also very prevalent in fish, raw fish if it's not cooked. All right, snails, and this is another one that can grow on aquatic vegetables. All right, so snails secrete these. They grow up on the aquatic vegetation, and we consume it in some of our more gourmet foods. So these have complete digestive, excretory, neuromuscular, and reproductive systems. Right? They lack circulatory and respiratory systems. So what do you think they have to do to survive?
Take our blood.
Pretty much. Yep. Animals such as snails or fish are usually intermediate hosts, and humans are the definitive host. This is what they look like. All right. Schistosomes is a prominent parasitic disease. Adult flukes live in humans who release eggs into the water, develop in freshwater snail into larvae. Larvae penetrates the human skin and moves into the liver to mature. Adults migrate to the intestines, bladder, and shed eggs, give rise to chronic organ enlargement. You're going to consume these on aquatic plants, or these burrow into your skin. And you guys realize in some countries they use human feces for fertilizer, right?
Yeah.
Okay. So here's liver flukes. It depends on where they come from, all right? But Fasciitica hepatolytica is the Chinese liver fluke, all right? It's on aquatic plants. But whenever you guys see hept, H-E-P-A, it's always going to be liver, right? It's hepatitis. Right? So just remember that. So if you see that, you know it's liver. Fluke lodges in the liver, all right? Some of these can go in the liver, or they will, what does the liver produce? It's green, helps digest fat, helps get rid of gram-positive bacteria.
Bile.
Bile. So some of these can live in the gallbladder. And the cool thing is they live in the gallbladder. Every time you eat a fatty meal, the gallbladder contracts, and we release a couple eggs, right, or some larvae. We can reproduce this whole species. There's lung flukes. I'm not going to ask you guys about that. All right. Just realize these things live in snails, crustaceans, or so if you're going to eat like lobster or shrimp or whatever, make sure it's cooked, because if not, depending on where it came from, you're asking for trouble. Do you guys know where shrimp comes from? From shrimp farms?
Yeah.
Well, shrimp are bottom dwellers, and above the bottom dwellers, they have fish farms, which they feed garbage to. So as the fish are eating, they're excreting their excrement, which goes to the bottom, which the shrimp live off of. So it's a whole, yeah, let's not talk about it. All right, so you guys give me like 10 more minutes or no?
Yeah.
Okay. All right. So let's talk a little bit about tapeworms. And remember, from day one, I said if you're going to tapeworm, you want the beef tapeworm. Why?
Because you can take something to excrete it out versus the pork tapeworm, which isn't going to come out very easily.
Why isn't it come out very easily?
Because it's latched on, and it will keep the head or something latched on.
Close. The pork tapeworm can actually leave your digestive tract. Beef tapeworm can't. All right. All right, so all tapeworms lack digestive systems, all possess the same general body plane. So these are tapeworms. So they're literally they attach to your intestine and they drop off their segments. Each segment, as it leaves the human host, if you pick up that segment and consume it, theoretically it can turn into a tapeworm. So I said, if you guys want to lose weight for your wedding or your high school reunion or whatever, get a beef tapeworm segment, or get two just in case the first one doesn't take. Consume it, and then when you're done losing all your weight, you can take the medication to make the head. But make sure you get a beef tapeworm, not the pork one. So these are the segments that get released. So each one of those, theoretically, does anyone know what gravid means? All right, when you guys go to grad school or whatever, gravid means pregnant. So if something's gravid, it has eggs or it is pregnant. It has a cuticle. So remember, this has a very thick cuticle. It's almost like waxy-like, and this is what causes allergic reaction. So everyone says, well, I lost all this weight because I had a tapeworm because it was consuming all my nutrients. It was, but it's also giving you an extremely, extremely large inflammatory process. So your intestines are inflamed with an inflammatory process. They're not digesting or they're not absorbing all those nutrients as well as they could. So that contributes a lot to the weight loss. And that's, if you're a kid or look at this, you're gonna love it. Watching right there.
Dude, nature makes the weirdest looking things.
They're kind of cool though, if you think about it, as long as you don't think about it too much. But like, wow, that's kind of cool.
It's
As long
like
as you don't
welfare.
have one.
So this attaches and doesn't want to let go, and this literally is attaching to your intestines. All right. So if you take the pill and excrete it, I remember I said it's a shitty job, but you got to find this guy, the Scolex. If you don't find this, it's still hanging on somewhere. So it's just saying, like, you're going to eat unconsumed pork. It's insisted in your muscles. All right. You consume that. How you get it. Make sure you cook your pork. Watch the video too with the Pepsi on the pork chop. You're going to love it. So the two different types, Sagnidia is beef, Solium is pork. So make sure you get the beef one. All right. So that's what it looks like. And look at how big this thing is. So your intestines are 30 feet long, right? This thing is 5 meters long. So that's about 5 times 3, 15 feet. So that thing is taking up half of your intestine. And each day or so, it's dropping off one of these segments. It has almost 2,000 of these segments. Each one of these proglottids is gravid. It carries eggs. So just remember, get the beef. You're gonna get a tapeworm, get the beef one. It doesn't leave the intestines. Yeah, most damaging if they lodge in the heart, eye, or brain. Remember, once it gets in the brain, causes seizures, psychiatric disturbances. And they're saying there's a lot of children in the South West. I said they got the sketchy pork, right, of the tapeworms. They have a lot of seizures and a lot of epilepsy there because they're thinking that a lot of these kids have beef or pork tapeworms. It's causing a lot of neurological problems for them. All right, so that's what it looks like. All right, that's when it gets into your brain with this difference in the hemispheres there. All right, we'll end it there. Please watch the video. You're going to love it. Watch the video of the tapeworm that pull out of the guy's nose. You'll love it. All right, guys, I will, like I said, I am going to try really hard. I'm going away for the weekend. I literally am going camping, so I don't know about internet, but I will see what I can do about chapter 20. Chapter 22, you guys are going to be on your own. All right, on mycoses, paracoccidioidomycosis, yeast and the beast, mold into the cold. Remember that whole story? Yeah. Okay. All right, if you guys have any questions, email me. Let me know. All right.
Can I ask you a quick one now, just because you weren't responding to other mammals?
I did.
Answer the one after I talked to you. Okay. Can you just send me the PowerPoints that are going to be on the test? Because I tried to open up one of them during this presentation and I couldn't. So I don't know if it's an issue on my end, but they come up when you email me them. So if you could email me them, that would be a huge help.
So you need for Unit 4 and Unit 5?
Yeah, if you could.
If I remember, I will.
Okay, thank you.
Right now. Hold on.
And then just to be clear about lab one more time, is there anything we should be turning in? Because I know we talked about the disinfectant lab.
Let me double check because I don't think we finished it. Katerina, did we finish the disinfection lab?
We did not.
No, that was the one we left off on.
Kirby Bauer. Okay, so no, I don't think you guys, we didn't have to hand in the hand washing lab, did we? Did we do that?
I believe we did. I remember doing that one.
That one we turned in. The disinfectant lab was the only one I had left in my lab folder. So I'm assuming.
That's where we ended. So no.
So
yeah,
don't turn it in.
Yeah, I have a
I
lab
remember
here.
doing that one in class, but not getting the results.
Right. Okay, so I have labs here from Dawn, Caitlin, Elizabeth, and Brooke for, I think, hand washing. So I have to put those in. Other than that, I have everything in Blackboard that I have. So if
There was
you,
the aseptic technique. For some reason, it's still showing as 0 for me, and I know that was handed in. I don't know why.
check today, Dawn.
Yeah, when I checked today, it said that I had a new grade in there, but it still showed 0. I'm like, wait, I know that was handed in because that was way in the beginning. I'm like, that was handed in.
All right. We put everything in. Grades are not due till like June 2nd or something. So if there's an issue and I find something, I can always do a grade change or we can still amend the grades.
Okay.
All right.
Okie dokie.
All right, guys, thanks for joining in. I hope I grossed you out a little bit or my evening will not be complete. All right, if you have any questions, email me. Please try to email me through Blackboard because sometimes I get a Gmail or I get a ECC or I get a Blackboard and it gets really confusing for me. Sometimes
You on every account.
I know, Katerina, I found yours. I don't know why you, but you did get chapter 15, right? Eventually.
Don't worry.
All right. Katerina, what are you using? Chrome or what are you using for your browser?
I am using Chrome, but I have a Mac, and that seems to cause a lot of issues.
Yeah, I'm gonna try. Have you guys heard of Go or DuckDuckGo? Have you heard of this yet? Does it work, Garrett?
It works as a search engine. I've never used it as anything else.
Yeah, I heard it doesn't keep your history because Google only happens to know all my shopping habits and everything, which is frightening.
Yeah, it's supposed to be a lot more private.
All right, guys, if you have any questions, let me know. Whatever, fix it. All right, stay safe, stay healthy. All right, guys, have a good night.
You too.
You too.
Katerina,
Oh yeah.
how do you open the PowerPoints? Because from my email, you like go up in the corner and you can access PowerPoint, you can access Word documents, and it's all through the Outlook email. So it's all saved on the web. And that's how I do it on my computer. So I'm not actually saving it on my computer. And it works all the time. I haven't had a problem since I've been doing that.
Oh, I don't know. I go to lessons and like I click on the file he has posted.
Mm-hmm.
And then that opens, it actually will download it on my computer without me like pressing anything.
The bottom left.
Okay.
Do you open it up in the bottom left, or how does it do it? You're on a MacBook.
It does it in the bottom left and like
In another tab, if you open your ECC email, you can, let me see if I can, I don't think I can do it. Maybe.
All right, I'll leave this open for you guys, just so you can talk back and forth, right?
Let me see if I can open it really quick.
All right, have fun camping this weekend. I'm gonna bounce.
Yeah, I'm trying not to get Cryptosporidium or any of those lovely diseases.
You should document if you find anything cool out there, but
Well, yeah, you know, if there's a tick bite, you know who they come to, right?
yeah, exactly.
Yeah, they come to me. Problem. Find Dr. Phil. Great.
So I also made the mistake of eating dinner while you were talking about these parasitic worms. And I looked over and I saw the anus with the worms on it, and I was like, great, this is great. So
I only ate part of dinner tonight too.
Yeah, I was gonna literally eat raw hamburger in front of you guys, but I'm like, no, I'm recording. I should probably get grossed out.
I know you're there. I know.
Oh yeah, I was eating shrimp too.
Okay, well, just don't eat raw bear meat, okay? Can you guys do that for me?
All right, I'll try.
All right, I'm gonna disconnect. You guys done? Katerina, are you done talking, or did you figure it out?
I don't think so. If you could just email them, because it only gives you me the option to open it on my computer even with Outlook open. So it must just be an issue with me. I'll probably get a new laptop over the summer. So
Probably not that. All right, I will. Actually, I'll try to email it to you on my ThinkPad. That's an IBM product or whatever. Okay. All right, I wrote it down.
Okay.
All right. Good night. Thank you.
Good night.